Good morning, everybody. This presentation is titled Healing the Workplace and Workforce. Solutions, I'm going to be talking about that a lot. Solutions for the growing crisis in substance misuse. Our panel today is made up of Cheryl Brown Meriwether, Julie Dostal, and Dr. Brandee Izquierdo. And I am your moderator, Dr. Joel Bennett. I'm going to start off here by mentioning some key points of these solutions before we get started as a learning device. Cheryl is going to talk about considering both traditional and new human resource solutions and use of formal roles of facilitators, coaches, champions, and peer support professionals, recovery specialists. Julie's going to be talking about use of capacity building, needs assessment, and the delivery of evidence-based curriculum. And Brandee's going to talk about taking simple steps, no shame pledge, toolkits, use of NARCAN on the website, and providing a treatment locator. So this is a range of solutions that you're going to be hearing about. There's something for everyone. Why? The workplace of the future needs as much of this as possible. We are in a very critical situation, but without further ado, I will let Cheryl explain that. Cheryl Brown Meriwether brings over 2 decades of experience in corporate HR management, addiction recovery awareness, and adult education to her role as Vice President and Executive Director of the International Center for Addiction and Recovery Education, otherwise known as iCare, and she'll talk about that. She is also the current 2-term president of the Greater Orlando Society for Human Resource Management. She's an active board member of Project Opioid and a former adjunct faculty member at the University of Phoenix. Take it away, Cheryl.
Thank you. Good morning, everyone. You know, a few days ago, I saw the results of a survey conducted by CNN and the Kaiser Family Foundation that said 90% of adults believe there is a mental health crisis in the country today. Now, clinically speaking, mental health and substance use disorder are co-occurring. And because the workplace is a microcosm of society at large, these issues do impact the workforce, and by extension, the direct and indirect costs impact both individual lives and corporate bottom lines. Next slide, Joel. Thank you. The problems are not new to the workplace, but since the onset of COVID-19, the scope of the problem has increased exponentially. Countless articles have been written about what is being called the pandemic within the pandemic. And as alarming as the numbers are, for example, 107,000 overdose deaths in 1 year, the data are largely lagging indicators. And that means that we're just seeing the tip of the iceberg now. Next slide, Joel. Thank you. Research tells us that 1 in 4 remote workers have been diagnosed with mental health disorder. The same percentage of workers whose jobs were labeled essential during the pandemic said they worked while impaired with alcohol or drugs. And that 70% number of illicit drug users that were employed or are employed, that number was documented prior to what is now the nationwide legalization of marijuana movement. So because substance misuse and addiction are not typically subjects that we talk about in the workplace, where can people who are struggling either personally or who have loved ones, family members, friends, co-workers, or even folks who are just curious about the topic, and where can they turn to get help? Do you know it is estimated that only somewhere in the neighborhood of 3 to 7% of people who actually need and want help will actually seek that help through their company-sponsored EAP programs. Next slide. Thank you. Let me tell you just a brief moment about Donna. So Donna can be one of your company's superstar employees. She's also a single mom with 2 young kids. Donna works remotely, and she was trying to go to school to improve her life until the pandemic hit. She couldn't help the kids with their schoolwork and keep up with her own schoolwork at the same time. Donna lost her dad in the early stages of the COVID pandemic, and her ex-husband, well, he recently lost his job, and he was already getting behind on the child support payments. And now the landlord sent her a message and said, oh, by the way, we're going to raise your rent about $400 a month. So for the most part, no one from Donna's job has a clue about what's going on with her in her life. No one would imagine that she's using alcohol, maybe a little marijuana that she gets from her brother every once in a while, and sleeping pills just to cope. And because of the fear and the shame and the stigma associated with substance misuse, she feels she has nowhere to turn. Joel? So now let's just play a little game of what if. What if Donna's alcohol and substance misuse started to get just a little bit out of control? What if her work performance started to suffer in some significant way? What would a typical HR response look like? Well, the recommended best practices are shown on this slide here. Substance misuse typically falls under the category of risk management in the workplace. So the practices shown here are time tested. They're highly recommended. These are not bad things, but notice, if you will, what they all have in common. These things, these practices are largely employed reactively. They are not done proactively. They only come into play after someone crashes and burns. It's a phrase that I use, sadly. Next slide. So by now perhaps I've done a pretty good job of painting a gloomy picture of the scope and the challenge that exists in the workplace. So now I'm going to put on a different hat and let you know that there really are some cool, some new, some exciting initiatives that are popping up in the workplace all over the country. I've listed some of them here. These approaches are as diverse as the companies themselves are that are starting to use them, yet they all have some things in common. First of all, these efforts, they have to be company sanctioned, and primarily they're led by employees who may themselves be what we like to call recovery champions or peer supporters. Peers are defined as people with lived experience, either having lived through mental health issues or substance misuse issues for themselves or a family member. I have the honor of working every day with some of these folks, and they're getting the approval of their HR departments, their diversity and wellness leaders inside their companies. They're forming affinity groups under the DE&I umbrella. They're leading Dry January and Sober September and other sober curious events. They're connecting with allies. They're partnering with health and wellness and EAP and other groups both inside and outside of the company in the larger community. Together, these folks are striving to create psychologically safe workplace cultures that are recovery ready, recovery supportive, and recovery friendly. Next slide, Joel. So the last thing for me is this, because my company, iCare, the International Center for Addiction and Recovery Education, we believe that people live and they perform best when they are not plagued by substance misuse or addiction. So we train and certify non-clinical, I'll repeat that, non-clinical professional recovery coaches and addiction awareness facilitators. And these folks work proactively, not reactively. They complement and supplement other existing services, but they primarily focus on working proactively in the workplace to raise awareness about substance misuse and addictive behavior. These coaches, the facilitators, they are skilled at using these new approaches that you're going to hear more about from the following panelists. They work in combination with existing best practices and workplace protocols, those HR things that I mentioned previously, the traditional stuff, the new and the traditional, we're working together. They're bringing these solutions, these approaches together to create what Joel mentioned as the workplace of the future. And since 2013, together we've trained more than 1,000 coaches and facilitators, not only from across the USA, but from more than 40 nations around the world. So I'm very excited to share more with you about that. Just reach out if that's something you want to know more about. And that concludes my presentation, Joel.
That's wonderful, Cheryl. And you'll notice in the chat box, you can see the contact information for Cheryl. We'll be sharing contact information for everyone as we wrap up here. I'm very, very excited about peer-based, ambassador-based, champion-based, advocate-based, allied-based programs that involve lived experience. And Cheryl's program is a very structured program, and there are many others out there. So this part of the presentation just is opening up the aperture that one of the solutions is peer support. Okay, so moving along to, and every solution you're going to hear about today is complementary. I have had a great opportunity to work with all of our panelists today, and everyone is contributing something special. And I am happy to say that here is somebody very special to me. Julie Dostal is the executive director of the LEAF Council on Alcoholism and Addictions. They're in Oneonta, New York. She's been in the field of substance use prevention for more than 25 years. Ms. Dostal strongly believes in communities as a driving force for positive change, and you'll hear that in this presentation. She's a sought-after speaker who frequently shares her enthusiasm, knowledge, and expertise at local, state, national, and international events. Julie is currently the prevention lead for her state, which is New York, the region's state opioid response. These are called the SOR grants that are around the country. And this SOAR project has a focus on integrating substance use prevention through workplace well-being. So this is wonderful to have the integration of workplace wellness and well-being with substance use prevention. Without further ado, please welcome Julie Dostal.
Good morning, and thank you, Joel. Hello to everyone from gorgeous upstate rural New York. I'm super glad to be here this morning. And I just want to start by letting you know why this work is so very important to me and why it resonates with me so deeply. I'm a woman in long-term recovery. I found and fumbled and fell my way into recovery about 30 years ago. And don't do the math, please. And what happened for me is very early in my recovery, literally at 4 months sober, a workplace took a chance on me. And they took a chance on me and gave me a job in the addiction space. I kind of wasn't expecting that. That's not really what I thought I was going to be doing for the rest of my life. But hey, here I am, and that's okay. So with that, as a woman in recovery, I embraced that opportunity with very much gratitude. I was grateful to have it. I was grateful to be there and to be doing this work, and have continued to do it for some time. And now I get to do some leading, conducting the train, so train wreck to conductor, and continue to do this work. And I'm now in upstate New York doing this work. Next slide. Let me tell you a little bit about kind of the background of prevention. I'm a preventionist. I've been a preventionist for a very long time. That is the focus of my work. Historically, prevention has focused on direct services for youth, families, communities, as well as trying to work on population level health with laws and policies and norms. Recently, prevention has started to address additional populations, additional focuses with prevention across the lifespan. So just think of this. I wrote a little note at the bottom of the slide. When we do public health work, we don't stop prevention when people hit 12th grade. We just don't do that. We don't say, oh, 12th graders, you've learned everything you need to know, go and do your life. We do diabetes prevention, heart disease prevention, hypertension prevention. We do all of that for the lifespan. It now makes perfect sense to do substance misuse prevention across the lifespan. Next. And with that, what we know is we need to work in the workforce with the workplace. Now, let me tell you a little bit about this backdrop of this work that we've been doing. I'm really focusing on the rural population. We've done some capacity building. We've talked to leaders. We've talked to business owners. And what we know about working in rural populations is small is really small and far is really far, because most of the areas, as you can see on this map of the middle of upstate New York, most areas have less than 25 people per mile. Most businesses that we've talked to had less than 100 employees. As a matter of fact, you can see from our capacity building, it was 58% of the businesses had less than 100 employees. And that little line, that 3 hours, is how long it takes to drive from one part of our catchment area to the other part of our catchment area. It's a long way. So next slide. What we did in looking at the rural workforce is we first needed to ask, what do you need? What's going on? We didn't want to go in and kind of have our hands on our hips and say, we're here to help. What we wanted to do is say, what's going on in your workplace? How can we help? So we did a needs assessment. We did stakeholder interviews. We did focus groups. We put out a survey. And in doing that, we were able to do some capacity building and build relationships. In rural areas in particular, relationships is everybody. There's no such thing as 6 degrees of separation in rural America. There's maybe 2 degrees of separation on a good day. So making relationships is incredibly important, which actually requires lots of coffee. We sit down and we have a conversation and we talk and we find out what's going on. We go back and forth about what they need and what they see. And here's what we learned. Next slide. Managers told us, so we talked with managers and supervisors and CEOs, and what we found out is they spend an average, now I want to say an average of 38% of their time. It went up as high as some managers and leaders telling us 70%. They spend an average of their time dealing with employee stress, burnout, mental health, lack of sleep, fatigue, general health, alcohol misuse, and other drug misuse. And what we've done is we've looked at those data. Next slide. We've looked at those data and we found out that not only is there a human cost, and there truly, truly is a human cost, but we worked with Dr. Bennett, and him and some of his team did some econometric studies around the data that we collected. And what we find is that in small businesses, that under 100, where most of our businesses are, the small businesses, the manager, $25,000 of their time is spent helping to manage employee stress, burnout, mental health, substance use. For the employee, their productivity costs each business an average of $108,000. Now, when you look at the larger companies, above 100 and above, so that's medium and large companies, what we found is that for each manager, there was an average of $41,000 of their productivity time spent toward managing employee struggles. And the employee productivity costs at a very real $3.4 million. And this is the sample size that we got. And you can see at the bottom the reference there to the study that was done. Next slide, please. So what did our friends, say our new friends, we went out and we built relationships, we had coffee. What did our new friends say that they needed? Well, under the general well-being, what they said was they needed communication, team building, soft skill development. They said they needed positive resilience and thriving training. They said their managers needed stress training. And on the substance use prevention intervention side, what they said they needed was educational health and consciousness training. They needed NARCAN on site and people trained to deliver NARCAN. They said and this connects to my co-presenters, they said they also would love to have peer recovery specialists on site. How awesome would that be to have peer recovery specialists integrated into the workplace? Next, please. So what we did was we took all of this information and and worked with Dr. Bennett to help to help adapt the evidence-based workforce intervention called Team Awareness. It's a wonderful, wonderful training. He helped us to adapt it. And now it addresses both general well-being, it addresses substance use prevention, and we are delivering this training. Dr. Bennett drew the circle for me in those areas of New York State that we went out and had these conversations with. And next slide. And in our early implementation of this adapted evidence-based program, the adaptations that we did through capacity building and assessment, we are already seeing an awesome response from our workplaces. We are seeing an increase in healthy coping, an increase in overall team resilience in the workplace, and an increase in being able to contribute to the well-being of other people in their life. So this is great work. It is fun work. And working in the rural community is a really special thing. And also, I would like to add that these types of interventions and adaptive interventions will clearly work in urban populations and suburban populations as well. Thank you very much. Joel, back to you.
Amazing, amazing, wonderful work. So as before, you'll see contact information for Julie in the chat box. Also, we will put into the chat box some of the research that we've been doing. We just had an article published yesterday in HR News. And so look for those links as well if you want to learn more about the evidence-based nature of this work. So more is coming. We're not done. It blows my mind to have the opportunity to present everybody here today. I have had a wonderful time working with the SAFE project, Stop the Addiction Fatality Epidemic, and it is a real honor to introduce Dr. Brandee Izquierdo, who is the executive director of the SAFE project. Her drive and determination, you'll hear all about it here, are built on making an impact within behavioral health, promoting long-term recovery, and ensuring communities are educated and have the tools necessary to combat the epidemic, the addiction epidemic, the one epidemic that we're all here to talk about today. She leads advocacy efforts to expand access to behavioral health services and recovery support services. She and SAFE Project provide technical assistance both nationally and internationally. There's so many tools that the SAFE Project has. And it's all about empowering others within the recovery movement. So I'm so excited to welcome Brandee today. Brandee, it's your show.
Thank you, Joel. And Julie, if I were closer to you, I would definitely, coffee is key. And I apologize if my voice is going in and out. I am working through a respiratory infection, but that's okay. We still show up today. And that's the beauty of recovery, right? We learn to show up. We learn to bring ourselves to the forefront and really adhere to our commitments. So I appreciate that. As Julie, Julie, I really appreciate you sharing the fact that you are a person in recovery. I too am a person in recovery. And Cheryl was talking a little bit earlier about Donna and all of the stuff, the messy stuff that was happening behind the scenes with Donna. And it really just came to me that, I am Donna. I was Donna. I was that person that, maybe dibbled and dabbled in what Joel talks about as addiction, the taboo subject that we never want to talk about in the workplace, right? And I dibbled and dabbled, and then it came to a point where there were circumstances, many of which were beyond my control, that really led to the fueling of my addiction, and it became intensive, it became impulsive, and then it just blindsided me and hit me in the face. I can tell you firsthand, addiction was not a career move for me. I was a person in active use who was in the corporate world. So I was that employee where there were many and many and many a times and many opportunities for interception. And it was unfortunate that my colleagues, my coworkers, my friends did not have the tools, the resources, and the solutions to help navigate me through. And as you can see, we always talk about statistics and the numbers and the people, but putting a face to that, I actually found myself in jails and institutions. And I just want to put that out there, that where I was then is not where I am now, but it's been a real journey. Next slide. So I really want to put this into context. I know that we talk about the numbers. Over 107,000 people have lost their lives to overdose. Quite often we talk about overdose in terms of opioid use disorder and overdose with opioids. And, really making it relevant here is 295 people. But those people aren't just numbers. They're friends, they're colleagues, they're coworkers, they're family members. And we need to remember that every single day someone is dying or struggling with a substance use disorder. I also want to make sure that everyone understands that addiction needs to really take a look at a broader scope and totality. We know that there's a lot of conversation around fentanyl, opioid use disorder, prescription use, all of that. But we also have to understand that addiction comes in many forms, and there's polyuse. Methamphetamine, cocaine. We see that a lot in the restaurant industries when people are trying to stay up and abreast of what's happening in their workplace. And focusing not only on the fatal overdoses, but the non-fatal overdoses. And I know that can be daunting, but it also can generate opportunity. And Cheryl spoke a little bit earlier about the 23 million Americans who have been diagnosed with a substance use disorder. To counter that, though, there are also 23 million, or at least over 23 million Americans who also identify as being in recovery. And we have to have that conversation, because individuals with substance use disorder who identify really struggle with complexity in terms of stigma, but more importantly, discriminatory practices, especially in the workplace. Next slide. When I talk to employers and employees, the first thing is this is a me issue. This is a personal issue. This is not a we issue. I beg to differ. This is actually a we issue. Cheryl mentioned earlier that over 70% are employed. I can tell you firsthand, I was one of those that was employed. I have friends and colleagues who are still in active addiction who are employed. Not only that, we also have to understand too that addiction is a family disease. This isn't just about me as a person and what my struggles are, but it's also about my family members, or my family members who are going through that struggle as well. And of those employees, 42% of them admit to being less productive or distracted at work because they have substance use disorder in their families. But interestingly enough, 95% of people who may have a substance use disorder don't perceive that they need help. That becomes a serious issue because we feel the shame and stigma associated with that. And only 10% of those who recognize that they may need help actually get that help. And again, the question comes, why? Well, it's all stigma. Stigma doesn't stop at the door. Just because we're trained in stigma, or we're trained in terms of substance use disorder and mental health conditions, does not necessarily mean that it stops at the door. Next slide. Studies have shown that public stigma can lead to discriminatory practices in the workplace. We're seeing that a lot in terms of the Department of Justice coming down and holding workplaces accountable through the American Disability Act based on substance use disorder. And we're also finding that people who self-identify as having a substance use disorder do experience discrimination in the workplace. and they have lower acceptance among colleagues. This is microaggression, micro insult, and there are layers and complexities associated with stigma. And it starts with the public, and then from there leads into systemic, and then from there self-stigma and the shame and the internalization that we feel as a community. So we have to learn to have those conversations, those candid, deep conversations. And sometimes it's through a cup of coffee, right? A cup of coffee can really bring people together. Next slide. The addiction epidemic, we talk about that from a public health crisis perspective. It's a personal issue. It's not a workplace issue, right? Well, that's wrong. It is a workplace issue. It is a community issue. It's a national and international issue that we need to bring to the forefront. However you connect with that. For me, it's personal. For me, it's entwined in everything I do. For some, it may be based on the bottom line and what it costs to the employer. You see here that cost to the employer can be based on fatalities, accidents, workman's compensation, medical costs, absenteeism, productivity, theft. So we know that in order for us to create healthy workplaces, we need to pull back and really start creating healthy employees. And that then will fuel the healthy organizations, which will generate and cultivate safe spaces and healthy workplaces. Next slide. Cheryl mentioned earlier too, obviously we're working on solutions-focused approaches, right? Our department, our Secretary of Labor is actually someone that speaks out about his recovery. And we're finding what I don't like to call a trend, but just this new movement happening in the workplace, and it's the recovery-friendly workplace. But what's interesting about that is you have to make sure that you have a recovery-ready workplace that is fueled and making sure that you have a recovery-supportive workplace. And then from there, it becomes a recovery-friendly workplace where we can normalize these conversations and sit down and talk about our struggles and our trials and tribulations, but also our triumphs with our colleagues and our coworkers and our management. What's also interesting, I can tell you firsthand for being someone in recovery, just like Julie mentioning, I was so grateful that someone gave me a chance and an opportunity after I entered the journey of recovery, that I was willing to show up and show out in any way I possibly could. And I still do that to this day. I show up for my commitments. And what we're finding now with the research is that people in recovery miss 13.7 fewer days than those who are not treated for their substance use disorder, and 3.6 less days than your average employee. And if we want to look at the bottom line, when we're talking about turnover, replacement, healthcare costs, we're avoiding over $8,000 per person that we invested. And I think we need to understand that, we invest in people, they invest in us. It's all about reciprocity and caring about the individual and being compassionate and empathetic in that workplace. We spend most of our time working. For us to silo or compartmentalize what's happening, it can't be to create that safe space. So it's important for us to take simple steps to move to a safe workplace and a safe environment. And that includes recognizing the impact of drug misuse, educating and engaging the workforce on a consistent basis, enacting policies that are conducive to a safe environment and a recovery-friendly workplace. Always training your supervisors and your employees, specifically your employees, because they're your first responders, and what the use of drugs or impairment look like in that workspace. And equity. I hear a lot of top-heavy conversations on mental health, but we need to create equity in terms of coverage for substance use disorder. And then obviously the leveraging of the employee assistance program, making sure your employees know that it's there and it's available and how to access it. Because sending the right cultural signals is key. The more we send those cultural signals, the more likely people are to step up and step out and say, hey, I'm struggling. I need help. Next slide. And Joel mentioned solutions. It's all about solutions. There's simple steps that you can take. I like to call it the Monty Hall approach. Door number 1, door number 2, or door number 3. Maybe I'm aging myself too, Julie, right? But it's also important, if we're not ready to have the full-blown conversation about putting NARCAN in your workplace, perhaps starting off by having a no shame toolkit or signs that there's no shame in getting help and addiction is a disease. Making sure your employees and your supervisors have access to the treatment locator, where if an individual says, hey, maybe I need help, you actually have a resource that can be handed over. And I can tell you firsthand from my personal experience, had I had some of that and there was a cultivated safe space, perhaps I would have reached out sooner and my journey would have began a little bit sooner. So I think it's really important for us to not only talk about the problem and the taboo subject, but come with solutions and a solutions-focused approach. And I am truly honored to be on the panel with some heavy hitters who are really passionate and compassionate and empathetic about this space. And with that, I'll turn it over to you, Joel.
Wonderful. Well, I am so excited to have everyone here today listen to these very powerful ladies. I cannot tell you, this is not just something they cooked up because of the COVID epidemic. They've been working on this for years, lots of wisdom, lots of depth, and lots of approaches that really work. And if we're going to move ahead, we really need to embrace prevention of substance use. This is what we need for the future. So just to recap, remember what Cheryl talked about, focus on peer support. Julie talked about the systematic capacity building work that makes this take in a rural community, a suburban community, to adapt evidence-based tools. And then Brandee talked about simple steps to make sure that people in recovery are heard, are included, and contribute. Here's how you can reach everybody. Again, this information has been available in the chat box. I'm so excited to, again, have Joanna and Wellness 360 have us at the table. Please reach out to any and all of us if you want to start being part of this positive, proof-based solution or any of the solutions that you heard today. I think that's all. I think that other information is in the chat box. You could also reach out to Gina Reardon from the SAFE Project, who's specifically working in the safe workplace project area.